My flat-faced dog kept throwing up entire meals hours after eating. Turns out his breathing struggles stretched his esophagus so badly it caused megaesophagus secondary to BOAS, but less common. Description: dilation and poor motility of the esophagus are caused by chronic esophageal strain or severe reflux. Leads to profound regurgitation and risk of aspiration pneumonia. Solutions: upright feedings, Bailey chair or similar, small, frequent meals. Prokinetics: sometimes helpful, but it depends on the underlying cause. Gastroesophageal reflux, GERD, control. Treat aspiration pneumonia aggressively if present. Improve BOAS to reduce esophageal workload.
Congenital hiatal hernia, especially bulldogs. Part of the stomach slides through the esophageal hiatus into the chest. In brachycephalics, increased negative intrathoracic pressure from chronic airway obstruction makes this herniation worse. It often leads to reflux, regurgitation, and poor weight gain. Solutions: 1. Correct the underlying brachycephalic obstructive airway syndrome, BOAS, to reduce pressure. 2. Medical management: proton pump inhibitors, omeprazole, prokinetics, cisapride, metoclopramide. 3. Surgical repair: herniorrhaphy plus or minus gastropexy in moderate to severe cases performed by veterinarians.
My vet told me my Frenchies vomiting wasn't actually vomiting. It's gastroesophageal reflux GERD. Chronic backflow of acidic stomach contents into the esophagus due to increased respiratory effort, hiatal hernia, or incompetence of the lower esophageal sphincter. Leads to inflammation and discomfort. Or regurgitation, passive return of undigested food from the esophagus. Common in brachycephalic dogs due to airway-induced esophageal dysfunction, reflux, or hiatal hernia. Often worsened by excitement and feeding immediately before exercise. Solutions: acid suppression, omeprazole or famotidine, sucralfate for mucosal protection. Feeding smaller, frequent meals. Addressing BOAS surgically to reduce reflux causes. Treat concurrent hiatal hernia if present. Avoid exercise right after meals. Your dog's drooling and refusing food isn't picky eating. It's esophagitis. Inflammation of the esophageal lining due to frequent acid reflux, regurgitation, or foreign body-like irritation. Causes pain, reluctance to eat, hypersalivation, and regurgitation. Chronic vomiting. Recurrent active expulsion of gastric contents. Can stem from reflux, gastritis secondary to BOAS stress, or concurrent GI conditions like pyloric stenosis. Bulldogs, Pugs. Solutions: anti-nausea medications, meropitant, aggressive GERD control, omeprazole, sucralfate, diet change, hydrolyzed or GI-friendly diet, feeding upright, treat concurrent hiatal hernia, reduce airway obstruction to stop cyclical damage, explore underlying causes, ultrasound, endoscopy, stabilize the airway to reduce negative pressure effects. My dog swallows so much air trying to breathe that his stomach bloats like a balloon. The vet called it aerophagia, excessive swallowing of air caused by struggling to breathe, leads to abdominal distension, discomfort, flatulence, and sometimes worsening of reflux or vomiting, a common side effect of BOAS. Pharyngeal dysphagia. Difficulty swallowing due to upper airway obstruction, enlarged soft tissues, or incoordination between breathing and swallowing. May lead to gagging, coughing, or regurgitation. Solutions: correct airway abnormalities, soft palate, nares, saccules. Slow feeder bowls if rapid eating contributes, stress reduction, and controlled exercise. Treat associated esophagitis or reflux. Neurologic evaluation if suspicion of concurrent disease.